right, good morning, everyone. Welcome to the Orange County Economic Recovery Task Force meeting of June the 24th, 2020. Hopefully for the men as well as everybody else, hopefully you had a good Father's Day weekend this past weekend. We have a lot going on within our community as we work within this environment of a COVID-19 pandemic. Of course, we're seeing significant numbers in our community where the virus is now raging within Orange County. We have over 5,000 cases, and we'll talk more about that today as we get into talking about how we reopen our businesses and the potential impact from our actual experience of the virus itself. I want to thank the task force members for your continued hard work over the past 2 months to assist the county in establishing public policy as we safely reopen. As you know, on Thursday, June the 18th, I enacted Executive Order 2020-23 requiring face coverings now in public places. Prior to the issuance of the executive order, we experienced a 10-day period with sustained triple-digit increases in COVID-19 positive cases. We have also seen increases in emergency room visits and hospitalizations related to COVID-19. During this period, I consulted with municipal leaders of Orange County cities as well as medical experts and healthcare leaders. As a result of the dramatic increase in numbers, the executive order was executed and went into effect on Saturday, June the 20th at 12:01 a.m., which requires every person working, living, visiting, or doing business in Orange County to wear a facial covering consistent with CDC guidelines while in any public place. We will have an update from our medical experts today as we continue to address the increase in positive cases in Orange County. A major sports league began to resume, as major sports leagues began to resume their 2020 season. We have an update from Alex Martins with the Orlando Magic on the NBA plan and their safety protocols, as well as Cesar Lopez on the Major League Soccer plan and their safety measures. We will also have an update from Eric Ushkowitz, the Economic Development Administrator for Orange County. He's administering the Orange County CARES Act for Small Business Assistance Grant Program. And we will also have an update regarding the individual and family assistance program that we offer here within Orange County. We are also bringing back the regional branding campaign and look forward to hearing the progress the committee has made over the last couple of weeks. As we continue to watch the number of positive cases increase, the need for public health, a public health campaign reinforcing the CDC guidelines is truly more important now than ever. I've asked Orange County staff to work on a print, radio, and digital public health campaign that focuses on minority and vulnerable populations and aligns with the regional branding campaign. The materials produced by the campaign will be shared with our task force members, small businesses, and houses of worship that receive personal protective equipment from the county or who have participated in the houses of worship town hall meetings. The materials will also be available on our coronavirus website. We thought that today would be our last meeting, but however, due to the rise in the COVID-19 cases, I'm asking you, the task force members, to continue to meet and stay engaged until the pandemic is behind us. We are not in a post-pandemic era at this point. We're still in the middle of a pandemic, and we may need your additional assistance as we yet to have the overwhelming majority of our businesses reopen at this point. The pandemic obviously has caused a somewhat of a slowdown of the reopening of businesses here throughout America, but certainly here within our community as well. And so with that, I'm going to turn it over to the co-chair of the Orange County Economic Recovery Task Force, Mr. George Argel, for the roll call.
Very well. I hope everybody can hear me. Thank you, Mayor, so much as always, especially for you and your team and your leadership of that latest executive, which is going to be so important to us in our business recovery for all of us here as well as our visitors. So, well, welcome everybody. On behalf of my co-chair, Tim Giuliani, it's good to have you all back. I'm going to go ahead and begin the roll call. If you would be sure to keep yourself muted until I call your name, and if I do at the end of the roll call, if I miss anyone, please do let me know. Let's go ahead and get started. Starting with Advent Health, I believe we have Dr. Shu today.
Yes, Vincent Shu here in place, covering for Scott Brady, who's unavailable today.
Great. Thank you, Doctor. For the Alphon Inn, Jesse Martinez.
Present, George.
Thank you. Black Business Development Fund, Inez Long.
Present.
Career Source Central Florida, Pamela Neighbors.
Present. Good morning.
Good morning. Central Florida Auto Dealers Association, Evelyn Cardenas.
Present.
First Street Entertainment, Doug Taylor.
Present. Good morning.
City of Orlando and Orlando Venues, Alan Johnson.
Good morning, present.
Hurley and Pin, Dan Ward.
Good morning, George.
Morning. Darden Restaurants, Dave George. Dave George. Don Julio's Mexican Kitchen, Larry Rodriguez. Larry Rodriguez. Dr. Phillips Center for the Performing Arts, Kathy Ransberger.
Good morning, George.
Good morning. Florida Department of Health in Orange County, Dr. Raul Pino.
Good morning.
Florida Restaurant and Lodging Association, Carrie Byrne.
Good morning.
Morning. Highwood Properties, Steve Garrity. Steve Garrity. High Regency, Brian Combs.
Good morning, George.
Good morning. J. Henry's Barbershop, John Henry.
Good morning, George.
Good morning. John Michael, Exquisite Weddings and Catering, Michael Thomas.
Good morning, present.
Johnny Rivers, Grill and Market, Johnny Rivers. Johnny Rivers.
Good morning.
Good morning. The City Osceola County Chamber of Commerce, John Newstreet. I believe John Newstreet will be joining
George, Mr. Newstreet's going to be on a little bit later. He'll miss roll call, but he said he should be on with us at about 10.
Very good. Thank you, Lucas. Lake County Agency for Economic Prosperity, Brandon Matoka.
Present.
Sea Spa and Nail Spa, Mary Chow.
Good morning, President.
Mosaic Hair Studio, Mike Van Benabil.
Present.
National Entrepreneur Center, Jerry Ross.
Good morning, George. Present.
Okay. Nelson Mullen, Broad and Casal, Wayne Rich. Wayne Rich. Orange County Public Schools, Dr. Barbara Jenkins. Dr. Barbara Jenkins. Orlando City Soccer Club, Alec Lattale.
Yeah, Cesar Lopez here for Alex.
Yes, thank you, Cesar. I know you'll be with us presenting later. Thank you. Orlando Health, Dr. George Rawls.
Present.
Orlando International Airport, Phil Brown.
Present. Morning.
Morning. Orlando Magic, Alex Martin.
Good morning, George.
Morning, Alex. Orlando Shakespeare Theater, Douglas Love Ramos.
Good morning, George.
Prospera, Augusto Sanabria.
Present.
Rejoice in the Lord Ministries, African American Council of Christian Clergy, Pastor Roderick Zach.
Present.
Rose and Shingle Creek, Dan Giordano.
Good morning, George.
Morning. SeaWorld Parks and Entertainment, Brad Gilmore. Brad Gilmore. Seminole County Government, Tricia Johnson. Tricia Johnson. The Mall of Millennia, Steve Jameson.
Good morning, George.
Morning. The Trentham Santiago Group, Conrad Santiago.
Good morning, President.
The Vineyard Wine Bar and Healthy Bistro, Deborah Linden.
Good morning, President.
Truist, Sandy Hostetter. Sandy Hostetter. UCF Rosen College of Hospitality Management, Dr. Yusing Wong.
Good morning, present.
Unicorn National Development, Chuck Whittle.
Good morning, George. I'm here.
Good morning, sir. United Safety Council, Chris Earle.
Good morning, George. Present.
Universal Orlando, Rich Costales.
Good morning, present.
BMD Ventures, Harold Mills. Harold Mills. Walmart, Monisha Brown. Monisha Brown. Walt Disney World Resort, Thomas Mathlam.
Good morning, George, present.
Morning, Snuck. Wawa Incorporated, Todd Souders.
Present.
Wyndham Destinations, Frank Eckel.
Good morning, George. Present.
Morning. YMCA of Central Florida, Dan Wilcox.
Good morning, George.
If I've missed anybody, please advise at this time.
Steve Garrity with Highwoods Properties, present.
Oh, great, Steve. Glad we called you earlier. Appreciate it. Thank you.
Florencia Rodriguez with Don Julio Mexican Kitchen.
Very good. Thank you so much. Anyone else that might have not heard my message, name, or left from the task force? Okay, very well. Thank you, everyone. With that, I'm pleased to go ahead and begin our agenda by going ahead and turning now over to my co-chair, Tim Giuliani.
Thanks, George. Good morning, everyone. The first thing we're going to do is look back and seek approval of the minutes from the June 3rd meeting. So at this time, are there any changes to the minutes? Hearing none, would someone give a motion for approval?
Alan Johnson, a motion for approval.
Thanks, Alan. Second?
Doug Taylor, second.
Doug, thank you. All those in favor, please unmute and say aye.
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 Very good. Very good.
Aye.
Thank you. All those opposed, unmute and like sign. Hearing none, please show the minutes approved. I'll turn it back over to you, George, for public comment.
Great. Thank you, Tim. So for public comment, in an effort to comply with the CDC social distancing guidelines and for the safety of residents and task force members, the Economic Recovery Task Force will conduct meetings virtually. Orange County remains committed to providing an alternative platform for residents to have the opportunity to submit their public comment. I will ask Orange County staff to read the public comments we received online and add it to the public record. Please note public comments received that do not include the required information will not be read. Comments that extend beyond the set time limit will not be read in their entirety. However, the resident's entire comment will be entered into the public record. Please note that the time allocated to each individual for public comment via online submission may be reduced from the normal 3 minutes based on the number of speakers. Well, Lucas, do we have any public comment for today's meeting?
Yes, sir. We have one public comment for your all's consideration today. The name is John Murphy, 13500 Riggs Way, Windermere, Florida. For the Economic Recovery Task Force, I wanted to share my displeasure with the mandatory face mask policy that the mayor has instituted in Orange County as of 6/20. The uptick in COVID cases is statistically insignificant based on the 1.3 million plus residents in the county and seems to be localized in just 2 or 3 Orange County zip codes. To create an executive order that mandates face mask wearing for all county residents is an overreach and infringes on individual freedom. It strikes me as a purely political move intended to instill fear in the populace and continue to harm the economic recovery. One can't help but think that the wife's mayor's political aspirations are a motivating factor. I hope this order will be rescinded very quickly. John Murphy. And that concludes our public comment.
Okay. Very well, Lucas. Thank you very much, and thank you for that for the residents for their comments. Now we move on to the agenda for the health update. We will, as we have in the past, begin with Dr. Raul Pino, followed by Dr. Shu from Advent Health, and then Dr. Rawls from Orlando Health. We'll begin by recognizing Dr. Pino.
Good morning, George.
Good morning.
So I have a little bit of data to go through. I'm going to try to not to take over all your time, but I think it's important. Let me just give you a general view and start with where the pandemic is in the nation, and let's see if these things start sharing. Okay, here you are. So as you can see, this is the global and the United States pandemic. And if you click on any of those dots for those counties across the nation, you could be able to see how the pandemic is performing in that specific area. And you can see for the Florida cases, also very similar data with counties highlighted in the map. The darker the county, the higest it is the incidence of the pandemic. Our testing, we have tested over 100,000 people, actually 111,595. We have so far a cumulative 5,502 positive cases, and that is putting us now at a 4.9 positivity rate. This is twofold what we used to have when we were the lowest. If you look county by county in our data, it's also interesting to see the distribution of the cases. And in the bottom, in the yellow bars right here, you have our daily number of cases. And you can see the progression to where we are right now. And up here in the distribution of cases, you can also see the age of the cases. Just to give you also an idea, our median age right now is 34 years old for the pandemic, 43 for the state. So it's a lot younger in Orange, and always been younger in Orange than across the state, but it's getting a lot younger lately. And these are by zip codes across the state, and you can see in red the areas and the zip code in South Florida that have the highest count of cases at this time. For the health metrics, these are some of the measurements that we have been following through the pandemic. And as you can see, everything is trending up right now for us. And that includes visits to the ERs for influenza or COVID-like symptoms, the number of new cases on the top corner in yellow, and also the positivity rate of where we are right now. Another information that I would like to share with you, let me see if this works today, is more specific data that we are following with regard to hospitalizations and other data that we normally don't share much now, because if anything, it's just because the fact that sometimes the time is not there to explain all the data. So in here, what I want to show you in the right corner in blue is how the state and the county compares. Hospitalizations so far, we have 428. Those are 7% of all cases. Death, we have 53. A few have added in the last couple of days, and that's concerning. Hospitalizations, 13% of all cases in the state, about 3%, and for death, about 3% of all cases. For Orange, long-term care, 126 cases in long-term care facilities, and we had 20 cases in correctional, and those are the percent. I also want to call your attention right here in the middle part to the daily positivity rate and how it started to take off basically since the second week of June. And we are right now at 17.3% yesterday. Yesterday, we received 2,683 results negative. we received 561, and that gives us a 17.3% positivity rate. This is also part of the similar data, but here in the lower left corner of your monitors, you are going to have the hospitalization data that we monitor. The first graph with the 3 lines, we monitor visitors to the ER by fever, cough, or shortness of breath. Those are the numbers, they are all increasing. And in the lower corner in blue, we have hospitalizations that were associated with cough, which has taken off since earlier this week. I also would like to share with you another dashboard that we follow. It was created just for Orange County. And if I can find it, I will find it. Let me read this down. So yeah, I think it's here. Okay, right. This one monitors bed utilization, ICU beds, isolation beds, hospitalizations, and ventilators in use. So bed capacity in the county is about 4,751 beds. As of today, the latest data that we have, there are 442 beds available in our county. We have 543 ventilators available, and we only have 270 ventilators in use. That doesn't mean that will be used for COVID, just means ventilators in use. Also, on the right side of your screen, you have the available beds for ICU adults, isolation, acute care hospital, pediatric beds, and long-term care. So, although the pandemic is increasing, raging as Mayor described it, hospitalizations are increasing, and the ICU is increasing, is not proportionally increasing as the pandemic itself. And it may have to do with the fact that I mentioned to you before that the pandemic is a little bit younger. The last data that I'm going to share with you is one that is generated at the Orange Health Department and not at the State Health Department. This one is coming up. It's a PowerPoint. It may take a little bit longer to come up. Okay, can you see it? So the data, the first data is the number of cases in ICU for COVID. And there you have 21, at the 21st of June, you have 26 cases. Let me see if I can increase the size. 26 cases 26 cases in ICU for COVID-19. You also can see that when we were the highest was on April 12th with 55 cases. So we are not there yet for ICU beds used, but for non-ICU beds, we also are at the highest that I can see in the data with 109 cases. And in total hospitalization, that includes ICU and total COVID hospitalized is 135 cases on June 21st. So that is increasing. This is also the curve that we monitor. So around June 13 is the highest that we have seen before, and this is based on symptoms. And these are the number of cases daily. And also that's where we are right now. Now, don't get misled by the curve coming down because that's the week that we're currently in. So it will fill as the data continues to come. And I don't think that we will see that much of a decline yet. And this is our rolling daily positivity rate average in the last 14 days. So this is the one that is most significant for us to follow, as we can see how our average it continued to increase through time as the pandemic number of cases continue to increase. And here is the last that I'm going to give you. This is our rate per 100,000 in our county. When we were the highest before, on April and on week 13 of the year, we have about 21 individuals per 100,000 with COVID-19 in our county. Right now, we have the highest has been on week 25, 121 people with COVID-19 per 100,000. That's the severity and gravity of the pandemic that we are fighting. With that, if I can answer any questions, I will be more than happy.
Yes, sir, Dr. Pino, we have 3 questions. Pastor Zach, we'll start with you.
Oh, it's in the chat. I just want to know if it's possible to know the numbers. I'm sure it is. The numbers relative to how many of the 5,374 cases have been cleared as no longer testing positive.
So of the 5,000 cases right now, yesterday was about 66% recovery rate. And it's going, it's decreasing and decreasing as the number of cases. So basically right now, go ahead. Sorry.
I'm sorry. Do you think that would be a good number to report as well? You know, I'm finished. Thank you.
Yeah, we report it to the public every press conference or recovery rate. We do.
And then I believe the mayor has a question for the doctor.
Dr. Pino, you know, during the public comment today, someone made an assertion that what we're seeing here in Orange County in terms of our new COVID positive cases, the individual suggested that it was statistically insignificant. And I just want you to validate that given what you just said, our experience, is it not statistically significant? What we're seeing here is not, you know, by definition, something is statistically significant when the likelihood that a result or relationship occurs in other than just simply by chance. So I want the citizens of Orange County to clearly understand whether or not this is significant or not, what we're seeing. So can you speak to whether this is significant or not?
It's beyond significant from a data point of view. There is no doubt.
There's no doubt that it's significant. And in terms of the response to what we're seeing, in your professional experience, how should we respond as a community to be able to stop the spread of the virus? What's the best way for us to attack this?
I think that the dilemma should never be, can we open the economy or do we not? Do we need to go back home? I think that there are guidelines that has clear impacted the pandemic, and we did it before and we can do it again. Of course, social activity will increase to a level the number of cases, because this is a pandemic that is transmitted by our interaction. But the reality is that if we adhere to CDC recommendations, and if we have the cooperation of the business community and the community at large, we could control this and bring it to levels that is manageable. We have to learn to live with this. What we can now allow to happen is that we are so careless that the number of cases will impact the health system. And that's when we are going to get into trouble. And this pandemic works like a clock. And I don't know, Mayor, if you remember 2 weeks ago, I said to the hospitals, get ready, you are going to see an increase. in 2 weeks. And it's not that anyone has a crystal ball. It's that the pandemic's behaving a way now that we know how it does. And it goes 2 to 3 weeks behind for every single major category that we follow. And the mask itself could reduce the number of new cases that we are seeing. And I hope that if the community adhere to what you just signed last Thursday, the next week, we can start seeing some decreasing in the number of cases due to people following the guidelines.
Thank you. I kind of wanted you to talk about it a little bit, why we're doing what we're doing. There is a group of individuals, albeit I think they're smallest group in our community, that simply just don't believe in the science. They think that what we're doing in regards to requiring the wearing of masks and other things, the social distancing, is just all for naught, that it's not something that we should be doing, that is politically motivated, et cetera. But when I listen to you all in the healthcare community who are the experts, who are monitoring these numbers on a day-to-day basis, I see valid arguments for what we're doing and the measures that we're taking as we're reopening. And so on behalf of the citizens, to keep us all as safe as possible, I'm going to continue instituting the type of measures that you have certainly recommended in this regard, because I believe that if we come together collectively as a community, then we will be able to control the virus, the spread of the virus to the extent that we can, to avoid the calamities of exceeding the capacities that we have for our hospitals and our healthcare system in general. And then, of course, the consequences of the illness itself can result in death, and we certainly have seen that. It's not a scare tactic that we're using here. This is, I think, our obligation to provide for the safety of the public that we are responsible for serving. So it is part of what I've said here with this task force is our goal is to involve the citizens directly in the decision-making processes that we use as we reopen. And so we have endeavored to do that in a number of different ways. And I do appreciate the candor and the information that the Department of Health has provided to us to help us shape public policy within this community. And I know there will be some other dialogue today, but I thought that it was important because I hear this sometimes from our citizens. Why are we doing what we're doing? But to me, the case that you laid out this morning is a very cogent argument for why we needed to do something. And to me, doing nothing was not a good option. So we are taking these measured approaches as we're moving forward.
Yeah, Mayor, you're absolutely right. And people should know also that this decision was not taken lightly, that you took your time to research the data, you consulted with us and some of the other medical experts that are in this group. And we also look at the experience that we had here, even for local outbreaks, where when we masked the outbreaks, the transmission immediately stopped. And there are a few examples of that. So I think that, of course, there's going to be always a group, the people that we disagree, whatever situation you might decide in this environment that we are living. But the reality is that block sourcing, when you block the source of the virus, a transmission kind of decrease dramatically. And I know people are taking masks as a political statement in some cases, but we have laws for helmets in motorcycle. We have laws for seatbelts, and those are intended to protect the public. And those laws have shown to be very, very effective in reducing the number of deaths. And also people are making the argument that the individuals that are getting infected right now are a lot younger, and of course they perform a lot better for health outcomes. But we also alerted that we were seeing trends in the data where we have multi-generational living, when the older individuals living in multi-generational households are getting infected by younger people who are active in the community. And we added a few deaths this week, maybe 3 or 4. And a couple of those individuals are those people who have no pre-existing condition, that are not that old. You know, someone who is 70, someone who is 67 years old is not that old anymore. And those people are dying, and they are dying in 1 or 2 days because they are symptomatic. They are not as long as the other people we have seen in ICUs for 15 days. We have people who go to the hospital and die in a couple of days because they are asymptomatic. You don't feel anything. The immune system doesn't respond as well. And when they get sick, they are really, really, really sick. So with that, it's not only protecting ourselves, but showing respect for the life of others who may be infected by us, directly or indirectly. A pandemic always starts with one person.
And we have a question from Mike. Mike, if you want to ask her.
Good morning, Dr. Pino. Question. Do we monitor how long it takes for people to get their test results back? I've heard up to 7, 8, 9 days now, and that seemed to not have been the case earlier in the pandemic. Is there anything the county can do to speed up the testing results?
So that's a very good question, and I'm there with you. In this case, I really don't know why it's taking so long. Part of the explanation could be that as we are testing more, there is a backlog at the labs. That could be one explanation. Now, different labs have different time turnaround. The labs that we use for our testing, when we do it, it takes about 24 hours. The county is using another lab that it takes between 24 and 48 hours. And right now, the one that is taking the longest is the convention center. Now, you can argue that the results that are 5 days to come lacks effectiveness into what you are intended to achieve with those results. So that is an issue that I have even argued, and I know this is not going to be popular, but I have said it before, that our testing strategy may need to change and concentrate more in protecting the most vulnerable populations at assisted living facilities and test more often in those facilities. Although the county has made a great effort and we have great results to show in assisted living facilities so far.
Next question comes from Dan, but before Dan, we just want to recognize that Wayne Rich is with us on the phone, and Harold Mills has also joined the meeting, just to note for the meeting minute. Dan, go ahead with your question.
Thank you.
Thank you. This is Dan Ward. Dr. Pino, you mentioned that a couple of weeks ago you told the hospitals to be prepared and that you saw this growth coming. Based on where we are now, are you able to make some projections for where we may be 7 to 10 days from now in terms of ICU usage, things like that? Is there a lag time between when people are hospitalized and when they may need more intensive care? What projections are you able to draw from the data of where we are today?
Hospitalization versus ICU and conversion rate, that's something that the hospital could offer better data than I, because that's very internal data that they collect, but we probably don't. But I will explore if that's possible. But it all depends on the individual, the gravity, and how long they've probably been dealing or assisting pre-existing conditions and the gravity of those issues. So with regard to where we could be in a couple of weeks, there is an algorithm out there in Philadelphia Children's Medical Hospital, I believe, that has it county by county. And we are not in a very good light on that results in 2 weeks from now. But that didn't, at the time, take into consideration the executive order that the mayor put in place with masking. So that factor by itself should have an impact on where we are going to be if people continue to adhere and if we get collaboration with some of the businesses from the area. And it's not every single business. It's not the entire business community, but there has been some businesses that have not adhered. They took it lightly, and this is where we are in part.
Next question comes from Chuck. Chuck, go ahead.
Dr. Pino, good morning. And to dovetail off what you just said, I know the mayor put in the measure of wearing the face mask, but if we look at when we went into phase 2 and opening the bars, the second week of June, and it correlates to the spikes. Also, the protesters happened exactly the same time. We had a gathering of 3,000 people downtown Orlando. So if you look at the downtown Orlando bars, what I hate to see is the entire community get penalized over a group of people acting irresponsibly. UCF has had a lot of problems over there because they're packing in parties out there. The downtown Orlando bars, you're putting in 500 people in a 2,000 to 3,000 square foot space. They started opening those bars before we even went into phase 2. And now we're seeing a direct result. If you look at the data from June 6th to 9th, and following a week later to 10 days later, as you guys have always told us, is how long is it's going to take to show up. That's why we have a huge spike right now. I look at many restaurants that I go to around town, and everybody's acting responsibly. You take a restaurant with a bar in it, a Roost Chris, a Morton's, an Olive Garden, whoever has it. The problem is not coming from those type of bars. The problem is coming from the non-eating establishments where people are cramming into those spaces. They have very loud music, so the only way you can communicate is to talk loudly and spit over each other, which naturally shows you why the cases have now come down to 29 to 30 years old, because the younger people are congregating. Not that they shouldn't congregate, they're going to, they want to. But as we look at regulating and setting measures, we should really pay attention to these bars, because I really think that that's the root of the problem, is the younger people. And it also goes to show why the hospitalizations are lower and the deaths are lower, because they can overcome it much easier. But I hate to see that type of behavior downtown cost the entire community to have to roll back measures, which I don't think economically our county can afford to do that. And I'm just curious to your concurrence on that, and then what the mayor's thoughts are and how we pay attention to those smaller bars that are filling up with people downtown.
So I don't disagree with the assessment at all. I could add a little bit in the sense that we also have a few, but very few restaurants, and the cases that we have seen in restaurants are a small number of cases, 4 cases, people that were at a table and someone at that table was infected. Those are the cases that we are seeing at restaurants. And the cases that, the large number of cases that we see at bars is I was at that place, but I didn't know who was infected. Meaning a large distribution happened. And in some cases, we can link more than 100 cases to a specific place. And that's alarming. That we have seen is that although we are refining the data, we can see people hopping from bar to bar in the data and the transmission happening from bar to bar in those areas. We are refining the data to be able to, with certainty, to pinpoint that. But the idea that you can operate in that environment, as you described, shouting, sweating, screaming, dancing, respirating, and high respiration rate, and not acquire the disease, then that's a fallacy. That it will happen. You will get it.
And then the next question.
And the other concern about that is that, I'm sorry to add this little portion, it will not stay with the younger population. Those people go back home. Those people see grandma, aunt, and those people visit assisted living facilities. And that's when the things are going to get over.
And Dr. Pino and Mayor, I don't think we should close the bars. I mean, they have businesses and they wouldn't survive if we did. But, Yeah, I know that Halsey Bashirs is looking into this right now, and the governor showed significant displeasure about that yesterday. But how are we as a community paying attention to this group of bars? I mean, you can go downtown and anybody can see it, and it doesn't appear that anybody's done anything to try to get them to pay attention to keeping lower counts inside those bars.
Chuck, I'll jump in here. Obviously, we're monitoring all of that. I have communications with Mayor Dyer and the other mayors within the county. And as it relates to the bars, there are complaints that are being received. And we have been working behind the scenes with the Department of Business and Professional Regulations, which holds, in many regards, the licensure over bars in terms of their liquor license, the beer licenses, et cetera. And you saw recently where, as a result of where the data indicates that there was a widespread non-compliance with the recommended guidelines, said bars had their licenses temporarily suspended, or what have you. I believe that if we get complaints from our citizens, we will continue to see that happen in many cases. We have been intentional about trying to get voluntary compliance as we have reopened. We want our commerce to continue, and we want it to continue in a safe manner. That is why this task force was put in place to assist us in looking at best practices as we have reopened. We're going to continue to do that. And unfortunately, we have some bad apples who have not followed the guidelines that were put in place. And we're going to continue to focus on the bad apples, if you will. We are going to continue, if we want to keep our businesses open and the commerce going, we have to make these other adjustments in some of our lifestyle types of behaviors in order to do that. That's the only thing that we're asking our citizens at this point to do, and we're gently nudging them into that direction so that we don't regress to the point where we have to see additional shutdowns or what have you. But obviously, in some cases, there's some restaurants, bars, et cetera, who have had to close their businesses because of a spread of the virus within their own employees within those locations. There's several of them around as well. So what I'm simply suggesting here is that if you want to stay open, if you want the commerce to return, then follow the guidelines, the simple guidelines that have been suggested. They are the most effective way at fighting the virus that is still living amongst us. And so that takes all of us doing our part, which is why we're going to kick off, a new campaign, a branding campaign, a mask-wearing campaign to be able to target some of the demographics where we see the reluctance, if you will, to follow the guidelines. So we're going to use different methods to be able to target the communications to certain demographics to gain the compliance that you see. So we're on it. This is all part of why we exist with this particular task force. So I'm with you, Chuck, in terms of trying to keep our economy churning at the same time.
Thank you, Mayor.
Okay, our next question comes from, I believe it's Conrad Santiago, CS Santi. Conrad, you're recognized.
Yeah, Pino, I'm curious, from your perspective, as we have actually different, what do you think has been highly effective at fighting the virus, and what do you think has failed or not been as effective? And you have sort of answered or alluded to different things, but I just want to know exactly what is your perspective in that sense.
I'm sorry, I was off. I say I couldn't hear you, the first part of your question. Could you repeat?
Yes, yes. As we have launched the different phases to reopen, and from your perspective, strictly speaking, what do you think has been highly effective at combating the virus versus what do you think has not been effective or not been successful at all?
So there is data, a lot of data that is suggesting that mask wearing is the most effective way right now to block the virus. It is, source blocking or source interference with this is critical, that you don't let those particles to get out of your range and travel to other individuals. That has been the most effective, even more effective than washing their hands, which we will continue to recommend, which is critical important as well. But if you keep your distance, if you wear masks, if you wash your hands, we can reduce this right now by 40% of the new cases, and go back to 25, 30 cases, even 50 cases a day would be reasonable to expect in a population of our level. But we are seeing almost 500 cases, and that's scary.
And what do you think hasn't been as effective of the different things that we have implemented?
Well, I think there are, I could lose my job on that in this one, but our testing strategy has not been the best. It has to do a lot with the resources and the testing and the quality of the testing and how long it takes to have the results. But in a pandemic environment like the one that we have at this level that we have today, testing should be limited to those individuals where it makes a difference in the treatment and the pathway treatment for the individual. We are using a lot of resources in massive drive-through testing. And if it takes 5 days to get the results, the test has no bearing on transmission. Because if it takes 5 days to develop the disease, if it takes 5 days to get the results, some people are going to be 10 days into the infectious period before they know they are positive. So I think that's a big contributor factor. And the other factor is that we didn't realize from the beginning that asymptomatic people have a higher role in transmission than initially thought.
Thank you. Interesting. Yeah.
Dr. Shu is better than me in all these issues, so he probably can add to it.
Mr. Thomas, Michael Thomas, you're recognized.
Thank you. One of the things I noticed is that, even though there's a executive order for the mask, many people aren't taking that seriously. I went into a Wawa yesterday and counted 16 people, and only 2 of them were wearing masks, including myself. Obviously, it's a hard thing to monitor, and I think many people don't believe that there's any ramification, is what I've heard from people, for not wearing a mask. Even though there's an order, there's no penalty, so to say, if you don't wear a mask. Obviously, we can't monitor everybody, but if we can hold the businesses responsible, kind of like what Chuck was saying, I think that's the key, is, making the business require these people to wear masks and follow the guidelines that we implement. And if they don't, then they will be penalized or fined. And I think if they know that, they may take it a little bit more seriously. Thank you.
Well, that's a policy question more than anything, but the intention, as the mayor said before, it was to encourage, guide, and show people the pathway to try to help us to fight this pandemic. Other places have put fines in it. I have seen most places that I went this weekend actually having a post sign at the doors. Please, there is an ordinance in place. You need to wear a mask. And I went to the Black Bean Deli on Mills and left my mask in the car. And these people know me. I go there every day for coffee. They took me around. I said, you need to get a mask. I totally forgot that I didn't have it. So I think we are going to experience that level. The Business Bureau is inspecting facility, is going around. But I think, as the mayor said before, what really is going to work is peer pressure. And if we all become enforcers of that, those guidelines, there is not enough police force or anyone out there to police 1.5 million. It's impossible.
This is Evelyn Cardenas, and I think once we get the campaign going and we can display something of the pledge, I think there might be more buy-in by businesses and maybe more peer pressure by the consumer, because there's going to be a dissonance. If I see that a business says they've taken the pledge, but at the same time they're not in full compliance, then I think I'm going to feel more comfortable saying, hey, you have the pledge. And also the actions that the governor took with zero tolerance towards like the bars and stuff that are not complying. I think those two things go hand in hand. So if we could get that campaign going as fast as we can, then maybe we'll get some more voluntary compliance.
And also, I think the responsible business owners, which are the majority, I heard now, also have a role to play by, talking to their peers and asking to take these steps. I was dealing with a business that I don't want to disclose, and they were not cooperating with me. And I was about to take some actions, and another business of the same type called these people and said, listen, you are going to screw this up for all of us. Because the reality is that if we are forced to take as a group, not me, but meaning the royal we, if we are forced to take additional steps, it's going to be very limiting because there's not much left in the toolbox. These are the tools that we have. So we need collaboration from all angles. And, Phil Brown is right there, and the airport is an example of a type of business doing what they have to do. They took on, is a large business with a hub of businesses, basically. And we saw the transmission they cut to zero, just zero a week after we got everyone masked. And that's a place that generated a few cases. So it's possible. It's very possible.
Dr. Pino, we've seen New York's cases go down a lot. Do we think that's herd immunity, that they're getting up there at this point because they've had so many large cases? Or what do you think is the reason their cases have gone down? Because I know they've reopened.
Well, they have been shut. They have been shut down for almost 6 weeks now. Some people have argued that to effectively eliminate the virus in a community, you need to at least shut down for 3 cycles, and that's 6 weeks, so that you stop transmission and you can address all these cases. But that's an economic killer.
Let me add, if I can, to Evelyn's comment. We are going to hear more about the branding campaign, which I think will be very helpful in this initiative to try to create the awareness and hopefully drive the behaviors that we're considering. So I'm going to go ahead and see if we can move on, because Dr. Pino did mention that we do have our other medical experts are going to share their perspectives, which may help us, inform us, and even provide some possibilities for other questions that our members of the task force might have. So with that, let me go ahead and move, if I can, to Dr. Shu, if we can get from Advent Health.
Yes, good morning. I will be brief, but really, if I'm going to try to share my content, if possible, to just kind of show you what we're seeing here at our facilities. This is I don't know if you can see it yet, but we are showing a tri-county area here of our 8 hospitals with Osceola, Orange, and Seminole. And, really what we're seeing is a bimodal curve where we have seen an increase now. So, and you can see, I think all of you can see the screen. We are currently at the highest census we've ever had for COVID. Our peak in April was 101, April 2, and now we're at 137. And again, this represents the hospitals in Osceola, Orange, as well as Seminole County. As Dr. Pino said, the good news is that the ICU capacity has not approached where we were in the first part of April. We are at around 24 ICU patients. We were more than that in the first curve. And we're seeing a little bit decrease in the age as well, but not as much as seen in the community. So our average age has moved down to around, I believe, late 40s or early 50s, where it was a little bit higher in that first wave. So those, we are not in a crisis mode right now, but we are very concerned about this increase. Typically, hospitalizations lag behind the number of diagnosed cases, and we were at our peak just a couple days ago, where we had over 4,000 in Florida. We are definitely going to see, I'm very confident we're going to see an increase of cases that are still going to go up. And of course, if even though the ICU proportion hasn't been that high, you get enough cases, you're going to start filling up your ICU and your ventilator capacity as well. So that is concerning to us. And then lastly, I just wanted to add one issue is that, wearing universal masks, of course, is mandatory in our facilities, as that's per CDC recommendations. We are, dealing with exposures that have occurred among our healthcare workers and physicians as well. And it's not necessarily because of patient exposure, but rather community exposures that occur because family members, adult or teenage children of our staff have been infected, and that puts our healthcare workers at risk. We are focusing on educational campaign to make sure that all our healthcare teams' activities, whether it be inside or outside the workplace, really needs to be measured and thought out very carefully, because we don't want to be putting our patients at risk if our healthcare workers are infected. And there is good data suggesting that universal mask works. There's also good data that patients who don't have symptoms may be infected, and that's another reason for universal mask wearing. So we're following this very closely. We're not in crisis mode, but we are very concerned and about our rising case numbers. And so what happens in the community affects us. And so just wanted to let you know we're following this very closely. But right now we feel very comfortable that we can still continue to take care of our patients with COVID, and still continue to take care of our other patients' needs as well. So with that, I will go ahead and stop, and maybe Dr. Rawls can continue on, and we can take questions later on.
Good suggestion, Dr. Shu. Thank you for that update as well. And so let me call on Dr. Rawls at this time.
Thanks, George. Orlando Helsing, very, very similar picture to what I've been seeing. Trends all consistent with community spread. Our inpatient numbers are up to 115 today. ICU utilization, ventilator utilization, much, much lower than we saw before. So we only have 2 of our patients on a ventilator right now. So that's good news, but as Dr. Pino did a fantastic job of really laying out some of the unknowns in terms of what will come next when we start to see spread into some more vulnerable communities. In vulnerable populations. So we're watching that ICU and ventilator number very, very carefully. I think the capacity in our system and in the central court system in general remains good. We have ICU space, we have hospital space. We do have higher inpatient census, and that's in part because we've had patients come back to care, and we know there's some sort of collateral impact there that we saw during the first wave, where people were putting up important healthcare issues. They're coming back to care now, and that's a good thing, but it does mean that we've got to work hard to maintain our safe environments. Our percent positive rates we're testing about 1,000 patients a day, looking very similar to the trends we're seeing in the community percent positives. So we've had a lot more surprise positives in cases that had presenting complaints completely unrelated to COVID. We've had one day where 20% of our inpatient volume at ORMC, for instance, where patients on the trauma service came into car accidents, broken legs and things like that, and just happened to be positive on their preoperative screenings. I do totally agree with Dr. Pino and Dr. Hsu and the mayor. I'm 100% supportive of your decisions on this. I think the mandatory masking is the right thing to do. I will just say, just as a caveat, that from the public policy side, I think it's the right thing to do. I think from the community side, it's a matter of compliance. Because we have mandatory masking in our hospitals, and as Dr. Hsu just mentioned, we still have issues with team member exposures where they're in their break rooms and they've let their guard down, that sort of thing. And we've also had counties around us that have had mandatory masking in place for several weeks and still have experienced the same swing up in percent positives and that sort of thing. So I think coupling the public policy piece with some of that real sort of clear and in your face messaging about compliance. Hopefully it's going to get us to where we need to be soon. But we're, 100% in agreement with that decision. I think it was the right thing to do. And just want to commend Dr. Pino for his leadership and that excellent, perspective he gave today.
Great. Thank you, Dr. Rawls. Let me take a moment now. If there might have been some additional question, I do want to recognize one member of our task force, Doug Taylor, who did have his hand up when I moved on to the next presenter. Doug, did you have a question earlier that you'd like to ask?
Yes, thank you, Mr. Co-Chair. My question is directed to Dr. Pino. Dr. Pino, I own a company that has some restaurants and bars in downtown Orlando, and we've banded together with several other large groups of owners. We've probably got 30 or so different brands of the bars that exist in downtown represented in this ad hoc group, and we've, to the best of our ability, followed the CDC guidelines in establishing our policies on how we deal with the public, how we deal with the pandemic, how we modify our industry to follow these best practices. One of the things that we've done very recently, particularly this ad hoc group, is in addition to mandating all of our staff wearing gloves, in addition to mandating all of our staff wearing masks, which was in place prior to Mayor Deming's order, but we support Mayor Deming's order, we are temperature checking all guests before they are allowed to step on property. And we have also banded together and started a testing program for all of our employees. And so our efforts at establishing that testing program so that we can quickly identify any infected employees and put them into quarantine and attempt to, again, following your leadership and your guidelines and CDC guidelines, so that we keep our team members and the public safe. My question really is very straightforward. I think it would be helpful, and I know I would appreciate if you could, if I were willing to submit something to you that we're doing so that you could review it and offer your comments, or I would invite you to come into my facility. I'm happy to accommodate you at any point so that you could review the work that we're doing to try to keep our team members safe and the public safe and keep commerce alive in downtown. So I'm very obviously sensitive to, and I, like you, read the reports, and they cause me great distress of certain businesses that have large numbers of infections. But I'd like to also present the other side of the case that, hey, there are large numbers of us in this ad hoc group that are attempting to amalgamate all the guidance that we're receiving and put that guidance into practice, and to do so safely. So in summary, is there a way perhaps offline that I could share all this information with you, get your guidance back, strengthen our protocols, particularly in regard to testing, which we see as important?
No, you're absolutely right. And if you invite us, one of our epidemiologists or I could go there and review your processes and make some recommendations. It is possible. Let me give you another example. The county jail has, and I don't want to jinx it, but no transmission has jumped from the community into the inmate population. And that's a very active place, socially speaking, with people coming in and out. They have effectively blocked the virus from getting into the general population. I'm bringing this because they were having some cases in their employees, some of the contractors, and we went back there and our EPIC reviewed the processes, and we detected a few things where another best practice would be more effective. So yes, we can do that.
Perfect. Thank you, Dr. Pino. I'll reach out through staff to get in touch with you, sir. Thank you so much.
Absolutely.
Great, thank you, Doug. Any other questions, comments from the task force now that we're completing this section of our agenda? Okay.
This is Evelyn Cardenas. I put a comment on the chat. I just think, what Doug is saying, that would be like a good case study to promote in the media of having a positive influence in the community and doing your part.
Very well. Very good comments and questions, and thank you again to our medical experts for great information to help us. All right.
George, just real quickly before the next agenda item, when I recognize that John Newstreet has now joined us for the minute. Thank you.
Great. Thank you, Lucas. No more questions for our medical experts. Again, thanks to all of them for that great, important information to us going forward. I'm now going to turn over the agenda to our co-chair, Tim Giuliani.
Thanks, George. Now for some really exciting news. Obviously, the NBA is coming to Orlando, and we're fortunate to have with us today the CEO of the Orlando Magic, Alex Martins, who's going to give us an update on the NBA's plans to restart their season here in Orlando. So, Alex, we're really excited to hear from you, and this is such good news. You have the floor.
Thank you, Tim. Good morning. Can you hear me okay?
We can hear you just fine.
All right, great. Thank you. Well, good morning, everyone. I'm happy to provide you with a brief update on the restart of the NBA season that, as I'm sure you all know, is going to take place right here in Orange County in Orlando at the Walt Disney World Resort and its ESPN Wide World of Sports. I'd like to start off by thanking Mayor Demings and this task force for your leadership. If it weren't for the great work and the great leadership that the mayor has given, during this unprecedented and uncertain time, and the work that this task force has done, I firmly believe that the NBA would not have considered coming to our community because of the fact that we're able to control the COVID-19 pandemic so well early on during the decision-making process. So I really want to thank everyone for that. And I also want to thank our partners at Disney. The Walt Disney World Resort has worked hand in hand with the NBA in trying to create a safe environment for us to restart our season. And we're very excited to be able to do that at Walt Disney World with our great partners at Disney. And so I'm going to provide a little bit of context for that for you all this morning, and then hopefully be able to answer any questions anybody has. As you all know, the NBA suspended play on March 11th due to COVID-19 and the spread of the pandemic. And since that time, through a number of various ownership and executive committees, we've been looking at hundreds of different models as to how we could potentially restart our season when our communities reopened and it became safe to do so again. And in evaluating all of those possibilities, our number one priority has always been to look out for the health and safety of our players, coaches, and staff that would be participating in the restart of our season. And then, of course, as you all know, and as I've stated, we determined that we would bring all of our teams to one location, which was the manner in which the league office felt was the safest way for us to restart our season and to be able to control the safety and the health of our players, coaches, and staff And of course, the league selected the Walt Disney World Resort and its Wide World of Sports. Our league has been working very closely, over the course of the last several months with a lot of health experts around the world. Have been in regular consultation with Dr. Pino as they determined that our community was the community that we wanted to bring this single location restart of the season to, in addition to consulting with health experts at Columbia University, Duke University, Johns Hopkins, et cetera, to ensure that the health and safety was our number one priority as we reconvened. So 22 teams will convene at Walt Disney World beginning on July the 7th. And when the teams do come into the resort, everyone in the travel parties will be quarantined for a few days in their rooms upon arrival, again, as part of the safety measures that we're taking to hopefully stop any, to avoid any spread of COVID-19 in this campus community, as we're calling it at Walt Disney World. So all of our players and coaches have started to convene at the individual teams' practice facilities as of yesterday. A regular testing regimen was begun yesterday for all those that will be traveling to Walt Disney World. There'll be travel parties of 35 people total for each of our teams. Again, one of the safety measures that we've taken as a league is to try to minimize the number of people who will be on this campus at Disney. Again, trying to keep it healthy and safe. And so each of those individuals is being tested every other day right now before they arrive at Walt Disney World. And once they do get to Disney, everyone that will be on the campus will be tested on a daily basis, again, to ensure that we are immediately able to catch anyone that does test positively for COVID-19 and to be able to isolate and quarantine those individuals from the rest of the campus community. So again, the teams will begin arriving on July the 7th. There'll be 3 weeks of training camp that will take place at Wide World of Sports, and then the games will begin on July the 30th. Of course, we will be playing without fans in the stands, but all of the games will be televised, not just back to the individual markets of the individual teams, but the games will be televised worldwide as well through our national media partners. The games will take place themselves at the HP Fieldhouse, the Visa Athletic Center, and the arena, 3 different facilities. And basically, we will be playing games all day long, rotating amongst those arenas and facilities, as we begin play. As we begin play, each team will play 8 seeding games, 8 more regular season games, for lack of a better term, to determine the final standings for the playoffs. And then at the conclusion of the 8 seeding games, there'll be a play-in tournament for those teams that finish in the 8th and 9th seeds. If there is a 4-game or less disparity within those 2 teams' records. And that will ultimately determine what the 8th seed in each of the conferences will be. And then we will go into our regular playoff schedule that all of our fans are accustomed to seeing on an annual basis. If the NBA Finals were to go 7 games, we will be on the Disney property and campus until October the 13th. So this will be a 3-month period where the NBA universe will be centered on Orange County and Orlando, and the broadcast of those games to the world will occur from our location for those 3 months. In terms of the housing of our players, coaches, and staff that will be on property at Disney, we will be utilizing 3 of their hotels: the Grand Floridian, the Yacht Club, and the Destino Tower at Coronado Springs. And all of our teams will be confined to those 3 properties, and no one else, no other guests will be allowed into those 3 properties while the NBA is on the campus at Walt Disney World. Again, I would stress that the health and safety of our players, coaches, and staff and everyone that will be in contact with them while they are at Walt Disney World is our number one priority. So a very stringent sanitization process is going to take place after every game. Every one of the courts and equipment and chairs, etc., will be sanitized before the next game takes place, as well as thorough sanitization of all of the practice facilities, weight rooms, etc., that we will be utilizing while at Walt Disney World. The will be taking place in a couple of the convention center spaces on the Walt Disney World property. And again, everyone of that will be on the campus will be tested daily. Everyone is going to be encouraged to stay on the campus and not leave the NBA campus at Walt Disney World. And if they do, if they were to leave, when they come back, they will be quarantined for a number of days, before they will be able to interact with their teammates and other players and coaches from the league. I guess I would start to conclude by saying that this is a great opportunity for our community and the focus that will be on our community during this period of time. I saw one report in the last few days that stated that, between the NBA and the MLS restarting their seasons, here in Orange County and at the Walt Disney World Resort, that the exposure that our community and Walt Disney World will receive will exceed that of the exposure that is typically found at the Olympics. Certainly the economic impact will not be there because of the fact that we're not bringing, the numbers of people into the community, but the exposure, from the international and regional television that will take place from these games will be tremendous. So finally, I would just state that as a league, we intend to use this restart as a platform to bring sustained action to the issues of social injustice that have been taking place in our country. We intend to utilize the platform to combat systematic racism, to expand educational and economic opportunities, particularly across our Black communities, and to hopefully bring meaningful police and criminal justice reform to each of our communities in which our teams play, but throughout our entire country. And I think you'll see our league provide a leadership role, particularly during this restart, to bring sustained action, as I say, to the issues of social injustice that are taking place. So, Tim, that's my brief update. I'm happy to take any questions if anybody has any.
Very good. Thank you, Alex. Any questions from members of the task force?
Tim, there's no questions from me, but let me just say to Alex and to everyone, that is truly exciting news. And as you can see, the NBA has gone through great lengths to ensure the overall safety of its players. And I think America and all of the world perhaps just waiting to be able to see the competitive sports re-engage here in our community. So I'm glad to see it coming. I look forward to working with the NBA on the social injustice issues as well. It's a great thing, I think, for our community. It's a good thing for America as well. So kudos to the NBA and the Orlando Magic as well. So thank you all.
Well, thank you for that, Mayor. We all know that sports has the great power to help us heal as we've gone through crisis in the past. And, that's certainly our intention here is to hopefully bring some healing and some positive sports action, to our community and to our fans around the world as we still battle through this pandemic. So thank you for that.
Thank you, Alex. And good luck to the Magic.
Thanks very much. We certainly hope that we could make some noise in the playoffs as they begin.
Yeah, that'd be awesome. We're looking forward to it.
Yeah.
at this point, let me turn the agenda back over to George Agell.
Thank you, Tim, and also my thanks, Alex, for that great update. I will tell you, as a person whose organization is responsible for marketing, promoting this destination globally, this could not be more exciting. The exposure is going to be amazing, and the timing just couldn't be better. But if that wasn't good enough, we're fortunate to have our next presenter share with us what's happening with Major League Soccer, where we also have this incredible benefit coming to our destination. So it's my pleasure now to recognize Cesar Lopez, CAO and Chief Legal Officer with the Orlando City Soccer Club, for an update on the MLS plan as our Major League Sports teams plan their return. So thank you, Cesar, and you're now recognized.
Thank you, George, and thank you, Tim, Mayor Demings as well. Just want to first start off by thanking the task force for the leadership. I'm going to echo a lot of what Alex Martin said, so I'll try to keep it a little bit brief, just for the sake of the rest of the time. But similar to what Alex Martin's mentioned with the NBA process, MLS went through a similar process and really recognize and recognize the leadership as well as the work that we were doing here locally in Orlando, and selected this as an opportunity to restart its 2020 season. With Orlando, all 26 MLS teams will be competing here in what we have branded as the MLS is Back tournament, which will take place similarly at the ESPN Wide World of Sports complex. The date will be a little bit moved up. So we're actually starting our competition on July 8th, and that will go through August 11th. So a little bit over a month for that. So as the rest of the sports world has seen, we had a terrific start to our 25th season. A lot of folks don't know that MLS has been around for 25 years. And then we also had to pause to address these issues. But as we restart, one thing that I'm excited about, and we're really excited about, not only locally here, but at MLS, is that we're going to have a really meaningful competition taking place in the ESPN Wide World of Sports complex. We're going to have a tournament that is going to be similar to more of a World Cup style event with a competition where there's going to be over $1 million of prize money available. The group stage matches will actually count toward the regular season. And then on top of that, the tournament winner will have secured a spot in the CONCACAF Champions League. So this is a really meaningful competition, and it will highlight the fact that all eyes, not only in the sports world, but globally, will be here in Orlando and really looking at the quality and competition that we're able to provide. For the purposes of this task force, I want to reiterate that we have the utmost confidence in our plan, and having all 26 teams come to Orlando gives us, and not only in Orlando, but in a centralized location, gives us the ability to control the environment, implement the safety measures, and maximize our ability to really protect everyone. Like the NBA, we are going to be participating and having these matches without fans, but we're going to find really, really innovative and exciting ways to engage folks from a media perspective, in-game activities as well. And we're likewise using this platform to hopefully, we're optimistic that after this tournament, we will be able to continue our season and use this as a launching platform with a revised schedule in each team's home market, where we will be able to follow with our MLS Cup playoffs as well as MLS Cup. Again, one thing that I really want to stress is the health and safety of our players, coaches, staff that are helping produce all of these events. I really want to thank Orlando Health. I want to thank Walt Disney World, our partners, in helping us create a really safe environment. So I will pull back the curtain a little bit on some of the protocols that we have in place right now, where like I mentioned before, we're going to have all 26 teams here in a centralized location at one of the resorts here at Walt Disney World. We've worked closely with our MLS Players Association to make sure there's alignment there. medical representatives, and the players themselves to implement all of the safety measures in and around what we've characterized as a bubble. As all the teams will be flying in, they will actually be flying in on a charter just for safety reasons, and will arrive no later than 7 days before their first match. We'll have travel parties of about 45 folks, whether they are players, staff, media as well, for each traveling party. And they will be tested really every other day leading up to their travel to Orlando. So they'll be tested twice. They'll have 2 PCR tests that they'll take within 24 hours. The players will also go through a baseline antibody test as part of their physical exams. And the league has actually partnered with a lab to help streamline that process. So we're really looking forward to having a really controlled environment. After the players arrive and player staff arrive in Orlando, they will all be tested immediately and quarantined as a result. Once they're in market, they'll be able to then train only upon receiving a negative result. So this testing protocol will go on. The cadence of it will go for every 2 days for the first 14 days of their time here. And then as it relates to the staffing, there will be the temperature screening will be taking place. Standardized screening process and questionnaires will be implemented for the folks that are servicing the hotels and or the convention centers where the MLS league and personnel will be staying. So really looking forward to implementing the mitigation measures and trying to adhere to all the local guidelines that we have been working on, not only from a league and club perspective, but also from a governance perspective. So we'll have the face masks, we'll have social distancing protocols in place, general hygiene practices will be encouraged as well, and then we'll have the enhanced cleaning and sanitization process as well. So, the schedule for the games will be released this week, if not sooner. And we are really looking forward to being not only the host match, and I'll echo a little bit of what Alex Martins mentioned, that this is a really important opportunity for us as a host in Orlando. But we're really looking forward to competing against our neighbors down south in Miami for the first match. So we're really excited about that. Our players are ready to go and ready to represent Orlando really well. So that is my brief update. There's another, actually, I'm sorry, I forgot. But there is one other thing that I did want to recognize is that the social injustice platforms that our league has taken on and our club has also taken on will be highlighted as a part of this tournament as well. So we're looking forward to creating lasting, important impact across our society. And I'll take any questions.
Great, thank you, Cesar. Any questions from task force members for either of our presenters, Alex or Cesar, at this time? Great. Well, the presentations were excellent. Thank you so much. I'm sorry. Comment?
George, no question, but also a statement. I'm just tickled to death with what we're hearing from Cesar and the Major League Soccer here. As a former high school soccer player myself, wasn't so great. This is exciting news as well to hear about the Major League Soccer influence here within our community. That this, with both of these sports coming, this is great. We appreciate what Orlando City has done really for our entire community as well to further expose our young people to professional soccer. I know that in communities of color, soccer has taken off as well as the community at large in terms of its popularity, and the professional athletes play a significant role in helping to shape how these young people view the world around them. And so we look forward to working with Major League Soccer as well on our social injustice platforms going forward. So thank you very much for bringing this to our area as well.
Thank you, Mayor. And I have to tell you, we must glow a little bit in the fact that what we've achieved in having these two leagues doing this here. I have many, many friends of mine across the country and other cities, destinations that would frankly kill for this opportunity that we have here. It's extraordinary. The exposure is going to be amazing. You might imagine we plan to leverage this because it really reinforces the trust that these leagues have in us, sends a great signal to consumers overall. Add to that the work that, Mayor, you're doing with the Face Mask Initiative, where half of all consumers feel it's an important factor in where they choose to visit a business. So all this is coming together at a great time and greatly appreciated. Let me move on now to our co-chair, Tim Giuliani, for another important update.
Yeah, thanks, George. We certainly do. There's almost there's such a long list of positive news of what people are doing in response and the opportunities that this has presented for our market. But in the vein of filling the void and really trying to support our small businesses, the county has been very active in trying to do that and has put forward an Orange County CARES Act funding program for small businesses through grants, and also for individuals and families needing assistance. So we're fortunate to have Eric Uskowitz, the Economic Development Administrator for Orange County, who has been working very hard on these programs. And we want to have an update from him and also to thank him for all the work and long hours going into this program. We hear from small businesses all the time of how important this is. So Eric, thank you for your leadership on this, and you're recognized.
Thank you very much, Tim. Appreciate that. And again, I'd be remiss in not mentioning Tim's organization, as well as a number of other folks represented on this call from the National Entrepreneur Center, City of Orlando, BBIF, Prospera, all have been a part of this program as far as reviewing applications. So we launched this on June 8th, and the program is moving along very well. Total registrants into the actual portal that we utilize for the program are over 10,000 now. Those are folks that have actually registered their email. They may at some point have realized that they weren't eligible, or there might be some duplicates in there, and that's why I think you'll see the large disparity between that and the total submitted applications. So the submitted applications, we're getting close to 4,500 at this point. Total denials are high right now. They're 62%. That was up over 70% last week. What we've done is gone back to a number of these small businesses and worked with them on some of the paperwork and documentation that may have been lacking, and we're trying very hard to turn a lot of those denials into approvals. The total approvals at this point are 1,179. Of those, we reached the 1,000 mark yesterday that have either been processed by the comptroller's office or sent to them or on their way. So that represents $10 million into our community. So great progress so far. The grants to be distributed are 6,500. So we obviously have a ways to go, but things are going well. As you can see by the total submitted applications and the grant goal of 6,500, we decided yesterday after a presentation with the Orange County Board of County Commissioners to expand the criteria to allow more businesses to be eligible for this. So the two big changes yesterday is that we are now allowing businesses that have received PPP loans, the federal loans, in the amount of $50,000 or less. They must provide documentation for that. And we're raising the total number of employees from 25 to 100. So we will continue to monitor this and make sure that we're opening it up and getting enough applicants into the portal to be able to fulfill the goal of 6,500. And now we'll move over to the individual program, which is being managed by Diane Arnold here at Orange County and her team. The portal has been open on the dates that you see there. The 8th and 9th, we received 3,500 plus applications. On the 15th, over 15,000, and on the 22nd, over 11,000. Total applications to date are 30,162. And we are, if you guys, as of the 19th, 3,500 applications have been processed. and are being submitted to the comptroller's office, and they're matching up the tax identification number for payment processing to get that much needed money into the hands of our residents. The CARES program for residents will be processing roughly 5,000 applications per week, and updates will be provided to those applicants weekly. So I wanted to keep it brief. I know we're running a little behind, but happy to take any questions on those two programs.
Very good, Eric. Thank you. Any questions from the members of the task force? Go ahead. Eric, I'm not seeing any, so at this time, thank you for the presentation and for the work, and we're happy to continue to support, as I'm sure all the other organizations on the line and involved in the process, to make sure this is as smooth as possible for small businesses. At this time, let me turn it back over to George for our final presentation.
Thank you, Tim, and thank you, Eric. Very important update. With that, we now have the opportunity. When we last met, members of the task force may remember that Roseanne Harrington, Chief of Staff to Mayor Demings, discussed the regional branding initiative. We're excited to have Roseanne back to provide an update on the progress made on that campaign. So thank you so much, Roseanne, to you and your team, and you're recognized, and I'll also let you introduce your co-presenters.
Thank you, George, and good morning, Mayor Demings and task force members. It's my pleasure to be back to provide an update on the regional branding initiative. As you recall, this was an idea that came from the task force, specifically the Consumer Confidence and Compliance Subcommittee. And I'd like to take this opportunity to thank Dr. Evelyn Cardenas, Pastor Reverend Roderick Zach, and Dan Ward for their continued involvement in this initiative as we moved from taking it from the task force and working with Orlando Economic Partnership and Visit Orlando to design, develop, and implement the campaign. And I'd also like to thank all of the over 100 business leaders, community leaders, and executives in the media industry and our regional partners for their participation. And I'd specifically like to recognize Ms. Becca Bidas, who is the Vice President of Communications for Visit Orlando, and Lorraine Martinez, who's the Senior Director for Marketing Communications for Orlando Economic Partnership, and Dr. Jeff Williamson, Director of Communications for Orange County, for their hard work on this campaign. They have worked in a short period of time to bring this to life, and we're really excited to provide you with the sneak peek this morning. So I'll turn it over to Becca and Lorraine.
Okay. Thank you, Roseanne. I appreciate it. All right, we can go right to the first slide. Next slide. There we go. Okay, so as you all know, this is, as Roseanne said, this was born from this team. Our objective was to create a local campaign to really build confidence and unity. And the safety aspect has become even more important from all the discussions that we've talked about today. We did engage businesses, community leaders. In the last 2 weeks specifically, we created an advisory team that has many of your own businesses on it. It includes businesses large and small, healthcare systems, 4 counties, Orange, Osceola, Lake, and Seminole, media executives from print, TV, and radio, and marketing professionals from throughout the region. So it's been a very diverse team, and we know that this is the community. It's critical that they're involved and able to support this campaign, so we wanted to get them in on the ground floor. Okay. So from this team, we really zeroed in on 3 main objectives and for this platform. Number 1 is really engaging businesses and residents to be accountable. This is the personal pledge, the promise element. There is an element of peer pressure if businesses do pledge to this, and then it's in a very visible way, there's elements in this toolkit. They'll have posters and ways they can communicate to consumers that they're taking the promise, and the consumers can help hold them accountable for that. So it's all about the personal pledge. 2, providing support and tools for helping businesses, especially small businesses, to succeed. The small businesses, we know, don't have big marketing budgets right now. So a lot of what we brainstormed was how can we use our own platforms to help support them, whether it's through training, employee communications, or communicating to their customers. And then this will help them succeed because we know through our own research at Visit Orlando, we know consumer confidence is bolstered when these actions are taken. You know, as George said, over 50% of consumers think face masks are important, not just for the employees, but also for other customers. And some of the biggest concerns that we're seeing from consumers is not, they trust the businesses, but they're worried about, are the businesses enforcing these measures with the other customers? So again, helping training and also communicating what the businesses are doing. And then 3, and this is kind of the peer pressure part, or positive reinforcement we say, is really encouraging consumers to positively reinforce businesses that are doing well. We heard a great example from the downtown bars today, and we want to use our own powerful platforms, the county, Visit Orlando, Orlando Economic Partnership, and all of our partners to really showcase and highlight those businesses that are doing a good job. I think there's a couple benefits there. One is it shows other businesses, it helps share best practices. And 2, for that business, it helps highlight them to a really broad audience of potential consumers and customers. So it helps showcase them to our residents. And then most importantly, we want to encourage the consumers to use their voice. I think we have some amazing channels, but there is nothing more powerful than consumers using their voice, and we're really engaging them in this. I'm really happy to say Yelp has agreed to help promote this with us. You may know Yelp added a whole safety rating campaign component for businesses that's been very popular. So they've agreed to help amplify this campaign. And then you'll see when Lorraine goes through the tactics, social media is a big part of it, of really engaging consumers and sharing their endorsements and referrals of businesses. Okay, next slide. So the goal was creating a consistent look, feel, and messaging and campaign, and some of the artwork we'll save for the mayor to launch on Friday. But the considerations, the creative considerations we had was really unifying Orlando. A lot of, especially the bigger businesses, have their own safety campaigns already. Some of the smaller businesses don't. So we're working with both of creating some artwork and a campaign that can complement what the big businesses are also doing, but that the smaller ones can personalize for themselves. Diversity from the beginning has been important, not just diversity in what kind of businesses that we're involving, but in the residents that we're talking to. So we definitely had a very diverse, on both factors, our advisory team. You'll see translating everything into Spanish and Creole has been very important. So you'll see our slogan below, which is safer, stronger together, translated in Spanish as well. We made sure it was something that was just as powerful in both languages. The safer, stronger together was voted on by the regional county representatives. So it's got the 4-county buy-in of Orange, Osceola, Lake, and Seminole. And then you'll see the hashtag we landed on, which was Do Your Part ORL. It's very action oriented. We played with a few that were hashtagged together or something that was a little more unified. And we thought, you know what, we really need to go with an action oriented tag that implies accountability. And then the other part that's really a creative element you'll see throughout all of it is visually emphasizing the safety measures, really starting to normalize that this is how we do business now. That masks are normal, social distancing, because the more we show it, the more we talk about it, the more we show other businesses doing it, it starts to become more accepted and just understood that this is the norm today. So with that, go to the next slide. I think we'll go to Lorraine can go over some of the tactics.
That we want people to ask themselves is, what is doing your part? What exactly does that mean? So we've relied on the guidelines that have already been set forth by the task force. So you'll see those there. We've incorporated a promise, so to say, that businesses can make to customers and guests, and then guests can also make to businesses and other patrons, that they will do their part by promising to follow those guidelines. So those guidelines mirror those set by the task force and include utilizing face coverings, having hand sanitizer available, enforcing social distancing protocols, limiting capacity, following CDC guidelines frequently sanitize high-touch areas, and offer contactless payment and ordering options. So we wanted to confirm with the task force that this was in line with what they see this promise being that the community can make in terms of keeping everyone safe and hopefully stronger, and working on this together collectively as a community. The next slide. So to get the message out, we've created a communications plan that encourages the use of the hashtag, which is hashtag #DoYourPartORL. And we'll use this, as Becca said, to highlight stories of businesses who are following the guidelines. We do want this to be very organic, have citizens use this hashtag, talk about their experiences, particularly their positive experiences, and also create that peer pressure among businesses to make sure that they're following the guidelines and doing the right thing. The campaign also drives people to a website, the website being doyourpartorl.com, and that includes a multilingual toolkit. As Becca said, we'll have materials in English, in Spanish, as well as Creole, so that businesses can take that right off the shelf. They're able to print those out and utilize those materials as they see fit. They also have the capabilities of making it their own, or in terms of any of their brand standards and their coloring, it could be customizable to their particular business and company. So we've created these downloadable materials that includes flyers, posters, social media graphics that can be utilized by businesses. We'll deploy a media relations strategy with media outreach and targeted pitching. We've enlisted the assistance of our local media partners to publish a public service announcement that encourages everyone to do their part to be safer and stronger together. We'll use a robust social media plan that leverages Facebook, Twitter, Instagram, even TikTok, that engages social influencers as well. We'll have weekly business highlights. We've thought of having certain days dedicated to a social media push, as well as some sort of reward system or contest system that we could also deploy to keep the social campaign going. We're relying on partnerships that allow the use of many in-kind opportunities, and we're also seeing the business community just come forward and agree to assist and amplify the messages of this campaign. So we want to thank WFTV. They have produced a PSA, which will begin airing following the State of the County on Friday. So they use their time, their resources, their talent to pull this together. So we're very appreciative of that. Entercom and iHeartRadio have also volunteered to air announcements on the Safer, Stronger Together messaging. And then companies like Orlando Utilities Commission, Orlando Health, many, the list goes on of the companies that have agreed to not only support this campaign, but engage in it and to help grow the campaign in the weeks and months to follow, because it is obviously, very important to get that safety message in particular at this moment and with the number of cases that we're seeing going up. So our ask to you is to please join us in this effort. We encourage to engage in the campaign. We're open to ideas. We do see this evolving organically in the community, and ideally businesses can make it their own, incorporate this messaging into their own messaging and their outreach efforts. And I will say that Becca and I are here to provide support and assistance. Our contact information is listed here, so please don't hesitate to reach out to us. We would be more than happy to help your teams, help your organization, and answer any questions that you might have. So before I turn things over back to you, Roseanne, I'd want to thank the mayor, the task force, and all of the members of the community that are doing their part and helping to promote this campaign and make it as successful as possible. And I think true success will come when we can say that the numbers are going down and we're on the road to eliminating COVID-19 from our community.
Thank you, Lorene and Becca. We really appreciate all your hard work. I know a number of people have to jump off the call. I just wanted to give a plug for the Mayor Deming State of the County, which is this Friday at 9 o'clock. And you can see the campaign He will be previewing the ad and the creative for the campaign. So stay tuned and please watch us Friday at 9 o'clock. Thank you.
Great. Thank you, Roseanne, and especially for your leadership pulling this together as you keep doing on such short notice and bringing in such an incredible group to help support it. So our thanks as well to Becca and Maureen for your leadership pulling this together, and looking forward to that State of the County address. So with that, let me go ahead and turn it over to Tim Giuliani.
Much appreciated. I'll echo that for Roseanne and for Lorene and Becca. It's been fun to see this all come together so quickly. A lot of work goes into bringing so many stakeholders to the table, and the three of you certainly have gone above and beyond on this. So excited to see it unveiled on Friday. We are going to get into open discussion. I realize we are up against the time. We have two comments that I can see based on the chat. So I'll go to first Dan Ward, and then Jerry will come to you second. So Dan.
Thank you, Tim. And I also echo the comments. Roseanne, Lorene, Becca have done a great job really turning that campaign around very quickly. I had a comment and a question that relates to the individual responsibility and what do your part means for individuals. I have heard some anecdotes, unfortunately, of some individuals who may not be getting the message about what their responsibility is if they believe they have either been exposed or if they have gotten testing and are waiting for their results. I have a friend who went shopping this weekend, had a mask on, and was doing all the right things. A young woman got onto the elevator with her, did not have a mask on, was on the phone talking to a friend about the fact that she had been exposed to the virus and was waiting for her test results. And it just spoke to the fact that somehow this young woman hadn't gotten the message of what her responsibility is and what do your part means. So I think if there's a part to play to get that message out of what your responsibility is, if you are in a business and it's a business that has had exposure, or you personally have been exposed, or you've had a test and now are waiting for the results, what is your responsibility in terms of quarantining, self-isolating, things of that nature? So just wanted to share that as kind of an anecdote that I've heard, and I've heard a few examples of that.
Yes, thanks, Dan. I think we all realize this call today has been kind of a mixed bag of cases going up, but at the same time, progress being made in our community on other fronts, and coming together through this campaign. Ideas like that, comments like that are very important, because if people don't have that message, we're not going to make enough progress. Let me turn it next. Jerry, I think you were next with a comment.
First of all, I wanted to say it was encouraging today to hear the small businesses being included in the conversation, but also from the marketing group. Thank you for your work, and thank you for making that available and applicable for the small businesses to use. At the National Entrepreneur Center, our Reopen Ready checklist is the second most downloaded piece of information, only second to the PPP loan information. So businesses are interested in that information and how to do it right. As we began to bring our staff back together, we looked at the requirements to bring people in and wear masks. And so part of our staff was saying, well, do we have to wear them? And so we need to be good models of those requirements for our staff, so that also people can see that if we're willing to do that as business owners, then we can ask those that are visiting. Lastly, I just wanted to thank Mayor Demings for his leadership in requiring masks. I know that wasn't an easy decision, but in doing that, we can't afford another shutdown. Our small businesses are struggling to stay in business. They're struggling to keep up with the requirements of the PPP loans, which means keeping people employed, and keeping people employed means being open. And so requiring masks, as we're hearing from our health folks, if that's the way to keep the curve from going up, and that's what we need to keep those small businesses open. Thank you, Mayor Demings, for stepping out in that leadership. We support you in doing that. But also thank you to your staff for providing the CARES Act, the $10,000 to specifically to the small businesses employing under 25. Our whole staff has been working at getting that money into the community, and that is a lot of money to small businesses, and that means the difference between them making it through this time and continuing to contribute to the community and closing up. So I just wanted to say I was very encouraged at having small businesses be a part of the conversation. So thank you.
Good. Jerry, thanks for making that point. Appreciate it. Next, I think Mike.
I kind of wanted to circle back about the comment of bars downtown and certain areas. I was recently in Savannah, and I know they allow open container laws there, and they had specific certain areas where people could really just congregate with a drink outside. Is that anything that we could possibly consider instead of, if we're going to allow bars to open, how about allow people to take the drink outside, maybe in areas, in downtown areas, so they can walk around and not be cramped in a small confined space? That's something that's possible. Just a thought. And then also a second comment on the testing. I've asked all my staff members to voluntarily go get tested. They all have. That's how I know about the timeline, the delay in testing results. But there are also walk-in clinics currently that won't test you unless you have symptoms. I find that kind of counterproductive. So there's walk-in clinics that will turn you away unless you specifically mention that you have 3-4 symptoms. Is that something that we could change?
Thanks, Mike. I'm not sure if Dr. Pino is still with us or not. Dr. Pino, are you there?
We can certainly have a conversation. We'll pass that on to Dr. Pino. Thank you very much.
Good. Thanks, Roseanne. I believe, Chuck, you're next.
Yeah, I have two quick questions. Does anybody on the panel know if Orange County Public Schools, I know Dr. Jenkins isn't with us, if they've made a determination on opening? And then the second, and George, I don't know if this would go to you or Roseanne, if you may know, the Orange County Convention Center, I know it planned on opening next month. Have we lost any conventions due to the uptick that we've had, or are the ones that we're planning on coming here still on track to come?
Yeah, Chuck, I would say in the convention center, we have been losing conventions, of course, since the virus issue pandemic began, since the end of March, and that's been consistently going forward. Our next largest event when we reopen, I said we'd never really closed, but when we actually back in action will be the middle of July with the AAU Girls Volleyball Championship. So we have probably 10, 12,000 coming in for that event. So we're going to begin at that point. A few small ones, and then we go into the fall where there are still a number of large conventions on tap. But candidly, a couple more or so have canceled as of not that terribly long ago, not related to this particular news of what you're referring to, but just in general, a lot of these large organizations have recognized that their potential to drive the attendance might be a little difficult, and they feel it may be better to postpone them. So they're coming back to us almost consistently only in the future year like 2021, where 2021 actually has a lot of business on the books. In fact, it's shaping up at the moment to be a very good year at the convention center.
Thank you, George. It just cauterizes our importance as a community that people need to feel safe when they come here, and the conventions, if they don't feel safe, they're not going to come. So we need to all do our part.
Exactly.
Thank you, Chuck. John Newstreet, you're recognized.
Yep, thank you, Tim. So I represent Osceola County on this regional task force set up by the mayor, and was also appointed by Osceola County to represent them on the subcommittee for the Safer, Stronger campaign. We had an internal discussion last week to evaluate those three little letters at the end of the hashtag, ORL versus CFL. The group was split, and we kind of tasked staff to go back and see, the benefit of one versus the other. I know the feedback within that group from the county representatives was geared towards CFL. And so if we are making this truly regional, and I'll note that Disney's Wide World of Sports sits in Osceola County, so we are very excited about the news with the NBA and MLS. But we also know all the strong points of a regional economy that we are. So I would just ask if what was learned from staff, why we kind of stayed with ORL or what the possibility is of expanding it to CFL. For the benefit of the full task force, you know, we did address the fact that one hashtag universal tracking is very important. But I did want to just kind of see if we learned something that led us to ORL versus CFL. So thank you.
Yeah, thanks, John. I'm not sure if there's a response or if that's for further discussion on the branding calls. Roseanne?
I think, John, thank you very much for your input. We did have a really good discussion about this. And I think at the end of the day, what we tried to do is try and tie it into the regional brand in our MSA, which is the Orlando MSA. And so we understand your concern. If there's others on the call that have a similar concern, if you would like to bring it up right now, but I think that was really what was the final deciding factor, was that we're the Orlando MSA and that's how we're known. But we're open to, if there's anybody else on the call that would like to jump in and voice their opinion, we'd really appreciate it.
Thank you. Well, not seeing any, Roseanne. So I think, you know, I know that's a discussion that's been had a number of times, and you know, it probably can get into deeper discussion with the regular meeting of that advisory group. So we might leave it for that discussion. I'm not seeing any other comments or questions at this time in the chat. So George, I will turn it back over to you for next steps.
Great, thank you, Tim. All right, for next steps, I want to mention that we will not be, we currently do not have another task force meeting scheduled, but we're going to keep you updated, of course, on the regional branding campaign, especially as Roseanne mentioned, reinforce at the Mayor's State of the County address where that'll be presented, as well as the public health campaign for continuing as always. Let me also add, by the way, that Mayor Demings did have to step out. We know the meetings run late, so unfortunately he won't be with us for any closing comments at this time. So with that, Tim, maybe back to you for any other comments and adjournment at this point.
Thanks, George, and thanks for everyone for your participation. And as Mayor Demings said at the top of the meeting, you know, given the dynamic nature of this pandemic, you know, we've asked for the task force to remain in force and in contact. So we will be scheduling future meetings, and appreciate all the comments, discussions, and special thanks to our guest presenters today on some of the positive news and forward momentum that we have as a community. Obviously, this is an important time for us to come together, and our community certainly has. And as Roseanne, Becca, and Lorene have laid out, there's even more ways for all of us to participate going forward. So I think it's going to take all of us to make this work, and want to thank you for your time and energy, and hopefully we'll put that same time and energy into this campaign to keep us moving in the right direction. So at this time, we'll call the meeting adjourned and look forward to seeing you soon. Thank you.
Thank you, everybody.
Thank you.
Have a great day, everybody.
Thank you.
Thank you.
Thank you.